It's a real pleasure to be able to speak with you today and to take up this theme of corporate responsibility, corporate social responsibility. And I want to talk about the ways in which healthcare might have a corporate responsibility to address the challenges of climate change and related ecological and indeed eco-social issues. I am a professor at the University of Toronto. I'm in the Institute of Health Policy Management and Evaluation. My scholarly interests are in health policy and health systems. I direct a center here at U of T, which supports traditional academic efforts related to sustainability and also practice change. And it's out of the work that we've done locally that we've worked with partners across the country, in particular UBC, Dalhousie University, and a national NGO called the Canadian Coalition for Green Healthcare to build Cascades. So Cascades is actually a grant. We have a 5-year term funded by Environment and Climate Change Canada to the tune of $6 million over 5 years. It's not a research grant. I am a professor, but this is much more about supporting and working with leaders across the health system to support climate action and awareness, and always wrapping in broader issues of sustainability. It can't really just address the climate challenge. So as an initiative, Cascades, we do work nationally. We have members of our team in BC, in Ontario, in Quebec, and Nova Scotia and New Brunswick. And we do work to build capacity through events like this, continuing professional development courses, resources. We also work to support practice change, really leveraging quality improvement theory, method, and infrastructure if it's a clinical practice change, and where there's a possibility for high quality and low carbon or more climate resilient healthcare or health services. And increasingly, we're engaged in pulling together some of the pan-Canadian expertise to provide more advice and policy development to support efforts across the country to move more collaboratively towards a climate resilient, low carbon and sustainable health system. And I'm happy to talk about all of that work. What I thought I would do is just start with what do we mean by corporate social responsibility, because it's actually one of those concepts that is both widely used and poorly understood. And I think there are many ways of approaching CSR, as I've cryptically placed it here. One of the common frameworks that's actually used, it's not the only one, is the triple bottom line. And I introduce it here, as you'll see, for a reason. First, the triple bottom line itself. What is it? It says that we should address 3 bottom lines in the work that we do. We should ensure that our people are cared for, and the people generally. And I think this is something that wellness professionals think a lot about as they think about the work that their organizations do. We should think about the planet, and we should think about prosperity. So one version of the triple bottom line, they all have this 3P vision. But one version of the triple bottom line is really, we'll keep doing what we do, we'll gain profit as it would be, but we'll do well as we do good things. So this is one of many courses that would help businesses to be profitable and purpose-driven. But what's interesting, and the reason why I used the triple bottom line as my way of intervening into conversations about CSR is precisely this intervention. So John Elkington actually came up with the concept of the triple bottom line almost 30 years ago now. He coined that phrase. And then a few years ago, he intervened again, this is in the Harvard Business Review, to say, I want to do a business recall. My concept has been misused. He said, this was never supposed to be just an accounting system. It was originally intended as a triple helix of change for tomorrow's capitalism. We need to pursue breakthrough change, disruption, and asymmetric growth, i.e. some industries must shrink while others grow. So this is a different vision, and I think we will always need to think about, for CSR and other interventions, just how far we're going to either maintain the status quo and do some better along the way, or more profoundly rethink. And that tension is built into CSR, and I think it'll probably be part of our discussions. And so I do have a presentation here. I welcome your intervention. I don't think you can unmute yourself, but you can put chats in. And if any comment you want to make is sort of immediate, like I need this answered now, or that's unclear, or I disagree, then I welcome that interruption. And otherwise, I'll leave time for us, I hope, to engage at the end of this. So I never know where to start with these conversations. I don't want to start too early and I don't want to start too late, but in terms of our collective understanding of these issues. So I am going to start a little bit early, but very briefly. You all know climate change is happening. You all know that this absolutely extraordinary global effort to pull together scientific knowledge, which is the Intergovernmental Panel on Climate Change, has gone through its 6th assessment process, and the science is increasingly good. We know climate change is happening. We know that the temperature is increasing, and it's not just due to normal climate variabilities, of which there are many. This is human-induced. It's anthropogenic. We are already at approximately 1.1 degrees Celsius mean global temperature increase. Canada is warming at twice the global average. And the projections from the IPCC is we will hit 1.5 by 2040. And the range, that's a point estimate, the range is 1.2 to 1.9. So there's quite a lot to do to change that. And we're already seeing the effects. And you'll all be familiar with the season of madness and chaos in British Columbia. Some of you might be coming from British Columbia. So at the top there, we have the heat dome in the summer of 2021, which achieved almost 50 degrees Celsius in one interior city, the associated wildfires, the atmospheric river, the trapped precipitation, deluge, again, climate-related shifts in the polar vortex and other such atmospheric and climate instabilities that created this tremendous flooding and the associated infrastructure damage. Why do I say that? Because all of these things affect our health. Now, climate change and greenhouse gases specifically are kind of weird. When we think about things affecting our health, we tend to think about a direct connection, a pollutant that is a toxin. That's not the issue with climate change. Greenhouse gases, I mean, don't breathe them in, don't sit there breathing only CO2 or methane, but it's really the issue for climate change is that it's moving through multiple pathways to create diverse impacts, whether that be malnutrition, cardiorespiratory disease, increased infectious diseases, particularly vector-borne, like in Southern Ontario, ticks are carrying Lyme disease. That's becoming endemic. And of course, as with all health effects, the impacts, the exposure, the vulnerability, the capacity to function and respond, these are socially and structurally mediated so that the health impacts of climate change are deeply inequitable across the globe and within our own communities, even within, different parts of an urban center. Climate change also affects our healthcare. So all of those images from British Columbia are acute shocks that increase demand. There was a spike in heat-related illnesses in the Lower Mainland in British Columbia during the heat dome. There was associated reduction in capacity. They had to stop doing all of the non-essential surgical treatment. But we're not just talking about acute shocks. These are chronic, they're cumulative and compounding. And they don't have to be an almost 50 degrees Celsius temperature increase to be the kind of heat stress that is increasing needs, particularly in more disadvantaged communities, and challenging our operations. And all of these shocks and stresses are affecting our facilities, are affecting our supply networks, are affecting our workforce, and are affecting our capacity to deliver services. And then the other part of this puzzle of healthcare's corporate responsibility with respect to climate change is this extraordinary fact that healthcare is in fact a significant polluter. So about 5% of global greenhouse gas emissions and similar categories of other toxic pollutants. And here's an image from the Lancet Countdown of 2021, which shows that, Canada, on a per capita basis, has one of the most carbon intensive health systems in the world. Always, as a health policy person, I will say Canada is always saved from last place by our friends to the south, who have quite simply the worst health system in the world, certainly the rich one. But that image doesn't help you understand the climate and broader environmental impacts of healthcare. I think this image does. This is a beautiful and horrifying image from Dutch spatial artist Maria Koik. And she's just pulled together supplies from her surgery. And so this is, I think, how we can see how healthcare, which is a service industry, is such an incredibly polluting service industry. We are highly dependent. And the thing that I need to stress is that folks often look at this image and they think, okay, how can we do a better job managing our garbage? How can we recycle? But what you have to understand from an environmental perspective is that the environmental impacts are built into the entire life cycle of these products, not just their disposal. It's built into the resources that need to be extracted, the manufacturing process, the transportation, the packaging, the use. So all of these products, they have embodied carbon, is what we would say, all of the emissions built into the creation of them, not just their operation, the creation and the disposal. So it's here, it's in all of the pre-treatments, it's in all of the post-treatments that we can start to see how climate intensive and broadly environmentally impactful healthcare is. Of course, it's not just climate. So I talk about climate because it's a fairly simple one in a sense, but this is an image that many of you will be familiar with. This comes from the Stockholm Resilience Center, and it's their conception of planetary boundaries, that there are 9 of them. And it's a conceptual framework. It has its strengths, it has its limitations, but I think it's a very useful framework to try and give us a sense of the range of ecological impacts that human beings are having. They are interwoven, but also we can think about them somewhat separately. This is the updated version of their ASOT from, I think, January of this year, where they tried to estimate novel entities, top right there, including plastics. And the point of this is to say, look, there is a safe operating space. The green space in the middle, that's the safe operating space that human beings can live within, where we can live in community with the environments upon which we depend, the ecologies upon which we depend, but also the suggestion that we are well in excess of some of those safe operating limits with respect to some of these planetary boundaries. And of course, it's not just ecological. Ecological impacts on our health are socially and structurally determined. And concurrently, there are a range of, I think, quite linked sets of social, economic, political challenges that mean that folks around the world are facing climate and ecological challenges without or with deeply inequitable social resources with which to face these challenges. So this is a modification of that planetary boundaries framework. This comes from Kate Raworth. So she calls this a donut for the Anthropocene. Others call it a life belt. What she's done is taken that concept of planetary boundaries, that ecological ceiling, the outer circle, and she said, that's great. There's an ecological ceiling. We should not overshoot, but there's a social foundation we should not fall beneath. And she's identified 12 dimensions of that social foundation, drawing on the Sustainable Development Goals, and therefore defined this donut, this life belt, others call it, of the safe and just space for humanity. So a challenging place where I think conversations are underway and actions are underway that suggest healthcare, is it potentially have some sort of social responsibility around this range of overlapping challenges. The concept of the anchor institution may be known to some of you. So the idea of the anchor institution is that some industries like healthcare, like colleges or universities, school boards, municipalities as well, they are anchored in their communities. They are not likely to leave. And they are big players within their communities. They can work independently and collaboratively to not just provide the services that people need, but to think about the entire operation of the organization to improve health. So they're thinking about employment, they're thinking about investment, they're thinking about their physical assets, what they buy. And so in this way, these kinds of broader ideas about how healthcare organizations can address both local imperatives and global imperatives, particularly with respect to their purchasing, what they buy, so that they are, as it were, shaping and making markets to support sustainable development. Okay, so that's the world as I see it and some of the challenges that we're facing. And so now, as we think about these issues, what's sort of going on that helps us to orient to what we might do? So I would say that we are seeing growing ambition around the world. What I'm showing you here is work from the English National Health Service, or NHS. This is their really very important commitment delivered in October 2020. So really at the beginning of the global pandemic, when folks were still struggling to understand what were the conditions we were facing and how would we manage. I think we continue to struggle. And what they said was, we will deliver a net zero health service by 2040 for a certain set of emissions, 2045 by others. A very, very broad ambition. And on the left, you have a picture of what those emissions are. I think it's a nice image because it helps us to see something that isn't intuitive. I think when folks talk about the fact that healthcare is a highly polluting service industry, the automatic assumption is we're talking about hospitals. They're big buildings, they have huge air handling requirements, they have to be on 24/7, they run big equipment all the time. So it's absolutely true that our hospitals, in particular, acute care facilities, rehab, and so on, are really resource intensive. But as you can see here in this pie chart on the sort of left there, of the green parts of some of those things that are directly, as it were, within a hospital, are still not a huge part of how healthcare has its environmental, specifically here, greenhouse gas or carbon, but broadly its environmental impact. So yes, it's in our buildings and the waste and water, but it's also in anesthetic gases, metered dose inhalers, business travel, patient travel. Medicines are unto themselves a huge category, very impactful medical equipment, and broadly the supply chain. So the things, the products, and the services that we buy. So that's a really growing ambition. And you can see from that pie chart, we are not just talking about efficient buildings, right? We're talking about more transformational change. And there's a growing number of frameworks that help us to think about that transformational change, help us to understand it, and align it with our understanding as members of the health community. So this is a framework from Andrea McNeil and colleagues. Andrea is a brilliant surgeon scientist at UBC. She's a lead within Cascades, one of the core partners. And she directs the Planetary Healthcare Lab at the University of British Columbia, alongside many other things that she does. So this is a really lovely framework, a 3-level framework for thinking about, okay, if healthcare is an incredibly polluting industry, how do we tackle that? So step 1, at the top, the obvious but ever important and always hard to prioritize, reduce demand. We know that there's oftentimes it's housing that's needed more, and certainly decent wages. There's active things that healthcare can do, like effective chronic disease management. Not all of our chronic disease management is effective, but clearly, similarly for disease prevention. But there are clearly strategies that we can advance and prioritize to try and reduce demand, not by turning people away, again, to stress, but reducing that sort of need. And then we get into the next category, which is matching supply to demand. And we don't always do this well. Sometimes we oversupply, sometimes we undersupply, and both of those are a problem. And in matching that supply to demand, we need to ensure appropriateness. We need to steward our programs for maximum efficiency. And arguably, we also need to rebalance the emphasis within our healthcare systems to some of those aspects of care delivery that can be high touch, low carbon is the phrase I like to use. So primary and community care that can provide some of the health and wellness supporting services that are key to maintaining health and well-being. And then we get into some of the more technical questions of how do we reduce emissions from the supply of the services that we need to keep supplying. And we think about reusable products and decarbonized transport and green infrastructure and other things like that. So that's a really nice framework for thinking about that in the context of our growing ambition. The other thing we're seeing, and I think for those of us in Canada and for Cascades, very, very important, are growing commitments. So many of you will know that there's a UN climate change conference almost every year, save 2020. They're called the COPs. COP26 happened last November. COP27 is coming up in Egypt in a month. And it was, the one that was hosted last year was hosted by the UK. And health systems featured very, very strongly. That's in part because, as I've just shown you, the English National Health Service is a global leader in making a commitment to driving change within healthcare. So there was a call for countries to commit to making their health systems climate resilient, low carbon and sustainable. And happily, Canada signed on. This is Stephen Guilbeault, our Minister of Environment, Climate Change Canada. You may ask, how does the Minister of Environment, Climate Change affect healthcare in Canada? Happy to chat about that. I have views on that, but in any event, it's a very, very important commitment because if nothing else, it represents a recognition that healthcare has to be part of the country's transition to a low carbon sustainable economy and society. And to this point, our federal government has really not recognized that this very important set of practices, this very important social institution, healthcare, is necessarily part, and I think arguably a very significant part. We have a big material footprint, but we have an even bigger social footprint, if you will. It has to be part of these changes. But of course, and you know this better than I, the growing ambition and the growing commitment exists alongside growing challenges. And obviously, you know, it's interesting. I'm teaching a session on health human resources, and I was looking for, you know, some good papers and found a paper on the crisis in the health workforce from about 20 years ago. And I think there's every year or every few years another crisis in the health workforce. But clearly the challenges being faced today and now are of a particularly acute degree in Canada and indeed around the world. And these are still somewhat old data from StatsCan because they were sort of in the midst of the pandemic, but tremendous stresses that the health workforce is facing, tremendous shortages. And, you know, this is just a recent set of committee hearings on the health workforce. And I think that I'll be really interested in your views on this. Some of us argue that while addressing the sustainability challenge, the issues of climate resilience doesn't address the workforce shortages, it can be for some significant portion of the workforce part of the solution of their stresses in terms of feeling, particularly if they're supported, not doing this on the side of their desk, if they're supported, that this is part of a long-term strategy for improvement. So now, 2 parts of my talk finished, third part. I wanted to talk a little bit about how do we do this? What are we doing as we organize for sustainability? And I'm going to draw on a toolkit or what we call a playbook that we developed as Cascades as a version 1 to help organizations and indeed individuals to think about what it is to get ready, what it is to prepare themselves to pursue this work. As I talk about this, I'm going to emphasize 2 different ways of working. So one of them is, I think, what we're doing today, in a sense, which is collaborating across organizations, across settings, to share and build knowledge and resources. And we need to do this, and we need to do more of this, because there is an extraordinary amount of expertise out there. And there's also an extraordinary amount of reinventing the wheel going on. And so I think some of our work here is always going to be this collaboration across provinces, across types of organizations, across disciplines to share and strengthen our capacity for action. But we also do need to do depth work, in a sense, vertically, within organizations, within settings, or arguably even within, you know, a profession or a discipline. in order to figure out ways to embed this. I made a comment about perhaps for some members of the health workforce, addressing sustainability challenges can be part of de-stressing, but only if it's not on the side of their desk. And that's a very significant challenge. So we are going to need to slowly but surely, not so slowly, build the vertical networks and the capacity within organizations, within sectors to be able to support sustained work, not just sort of one-offs. So with that as a sort of backdrop, a few further comments on how we're organizing. And a first one that probably doesn't bear repeating is that we are going to collectively need to come to terms with why the case for change. We are going to have to reiterate this to colleagues and sometimes to ourselves, why we're doing this, what we think we can accomplish by doing this, because we do need to stay motivated and engaged. And always, as you will know, I think probably as wellness professionals, you know, a lot of the work we do, where I think one of the first principles of community organizing is start where folks are. So we always need to start where folks are that we're talking to and help them to understand the case for action and change. But then what do we do? So here I've just got 4 domains of concern. And what I wanted to briefly talk about was the challenge and opportunity to think about these both in a sense as distinct domains of action, where we could prioritize one, but where ultimately we do need to connect the dots. So for example, a lot of the work that we would do to reduce the climate harms of healthcare will concurrently improve its sort of nature positive. If we reduce the quantity of single-use plastic items, we are also reducing that resource extraction and those pollutants. And that is often going to be the case, but not always. We will also face issues where there are additional toxic hazards that are important not because they're particularly climate impactful, but because they are pollutants. And sometimes we will find tensions that we will need to grapple with. And in all of this, we will find that there is sometimes good evidence and sometimes less good evidence. And we need to be honest about that. And we need to figure out how to move forward while also continuing to develop our knowledge in these very important areas. Another point of both synergy and potential tension is between reducing greenhouse gases and this challenge of climate adaptation and resilience. So there has been in the recent history of sort of climate organizing, a fair bit of tension between those who say we need to reduce greenhouse gases and those who say we need to adapt to the shocks and stresses that climate change is and will continue to bring. I think we're increasingly understanding that it is a both and not an either or. We need to, you know, the most obvious points of synergy and tension actually are for our facilities, building facilities that are both in the materials used and in their operation, reduce climate, greenhouse gases, but also are built to last. And perhaps, concepts like a passive house, so building a building in ways that make it really quite resistant to external temperature, for example. So that's both a resilience strategy and a greenhouse gas reduction strategy. But there are tensions. But we need to grapple with them, because it's not an option to try and future-proof our services without also thinking about how do we reduce the harms of those services. And finally, this fundamentally challenging concept of social sustainability, which has many, many meanings, not all of them aligned. So supporting local community development, building global supply chains that remove modern slavery, remove child labor from our healthcare supply chains. Because I can assure you that our healthcare supply chains have modern slavery, including child labor embedded within them. But all of these are the things we have an opportunity to increasingly grapple with and address. These are the domains, I think, of concern. And as we address these domains, and really across all of these domains, there are areas of activity. So some of these are going to be quite clinically oriented. in terms of thinking about our care to improve patient outcomes, make care less carbon intensive, reduce the need for care, and I should say the resilience of our care. So recognizing that we are both, let's say, medication management, both reducing unnecessary prescriptions or prescription overload, but making sure people are getting the medicines they need, and then also being attentive to heat risks, to the risks that are associated with heat from certain medications that are, for example, that are not heat stable or that make the individual less able to regulate heat. And so those things are going to happen together. We can think about our facilities and estates. Those are traditional areas of sustainability expertise. But there's, I think, capacity to increase our ambition, to really think about how I'm really interested in the question of trying to better connect the dots between municipalities and healthcare organizations to really redesign the cities of the future with healthcare much more intentionally integrated within it, not fortresses set apart, but integrated systems of health and social care with essential acute care and other forms of sort of facility intensive care. I think there's tremendous potential there. Procurement and supply chain. Our purchasing power is enormous. About a quarter of the money that goes into a hospital goes out the back door buying goods and services. When it comes to medical products and services, quite simply, healthcare is the only buyer. So we here in Canada and around the world can individually and collaboratively transform the nature of those markets. And then we have a role to play in all of the other products and services that we buy, whether that's paper or laundry services. This is a huge lever for change. And food and nutrition is a really powerful and interesting issue. That's why we sort of pulled it out. And I think you could lump and split these areas of activity in many different ways. There's an organization called Nourish Leadership that really argues that food is a critical way of rethinking healthcare and our relationship with communities and our relationship with health and wellness, because food is about, it's culturally significant. It's important for our economies and the social arrangements around us locally and globally. It's incredibly important for the health of patients in inpatient settings, for the workforce that works within these settings. So thinking really comprehensively. And all of these activities have the potential to have an impact across all of those domains: greenhouse gas reductions, adaptation and resilience, nature positive, and social sustainability. Okay, this is my last substantive slide. So I've suggested a couple of things. We need to make the case for change. We need to think about the domains of change. We need to think about the areas of action. And I think all of those can be done through sort of vertical networks of collaboration, as well as, horizontal networks of collaboration, as well as vertical depth. But when it comes to some of the work we need to do, it really needs to be at that vertical level of deepening our capacity to do this work. I think this is incredibly important. And a lot of this came about, these particular concepts, in thinking about hospitals and health authorities, but it's also relevant really within any organization that is taking on this mission. Part of the work that we've done, particularly locally, has been about trying to elevate the work of frontline folks and staff to the senior leadership and to the boards, to help them to understand that this is something their workforce cares about and that they need to support. So reporting into senior leadership, ensuring that the board understands that there are climate risks and climate accountabilities and broader sustainability accountabilities. And that's a classic corporate social responsibility set of issues. So we need to think about how that happens. Measurement and reporting. Measurement is vital. We need to measure what we're doing. We need to know if we're having an impact. Measurement is powerful because it helps to distill a lot of complex information into, things we can aggregate and average and trend over time. So are these events effective? Are people participating, and are they satisfied? Very important. But the strength of measurement is always also its weakness. It minimizes, it reduces. And so we need to use measurement very effectively, oftentimes for learning. and for learning systems that internally understand and evaluate their performance rather than targets and terror. A big issue is to work cross-organizationally. A lot of hospitals and health authorities are already doing a lot of work, but they haven't connected the dots. And part of reporting to leadership and governance is connecting the dots across their organization between their medication optimization, their leadership accountability, their sort of health standards organization, compliance to leadership expectations related to environmental stewardship, their parking and infrastructure issues, their food, a range of things that they're doing with respect to environmental services and waste management. All of those need to be brought together so that there is cross-organization view and understanding, coordination, and capacity. We do need people charged with this. And at the end of the day, no organization is an island. The system is more than the sum of its parts. And individual organizational entities doing their best will not get us there. So always partnership is vital, including organizations working as networks and for and as part of systems. And that's the end of my talk. And I will leave you with this slide, which I think we'll leave up for a moment, and then open the floor, hopefully, to some questions.